The expectations of big data in healthcare are high. Big data technology would enable us to predict epidemics faster, provide better personalized care, and diagnose patients earlier. It is not surprising that policymakers and politicians are becoming convinced of the prospect of fully data-driven and cost-effective personalized care. We took up this challenge in the BigMedilytics project. We learned that big data technology also raises ethical questions. Some ethical aspects are obvious. For example, discussions about securing privacy of patients' data. However, ethical questions go beyond this, as I will advocate in this video. What does ethics entail? Ethics is more than just a set of abstract principles. It is also something that everyone implicitly or explicitly uses in their daily work to decide about what is good or bad. Health professionals and data scientists working with big data technology continuously make ethical decisions, even if this is not always made explicit. For example, ethical researchers have expressed concerns about the harmful effects of aggregated data analysis at a group level, or the lack of transparency in the decision models that underlie analysis from machine learning. These processes can provoke discrimination based on personal traits when the algorithm of the dataset is not balanced well. These examples make clear that it is important to take the ethical dimensions of big data into consideration. By interviewing 160 stakeholders in 8 European countries, we studied these ethical arguments. We talked with medical researchers, hospital managers, healthcare professionals, data scientists, and big data technology developers. We also talked to members of ethical committees, legal experts, policymakers, and patient representatives. Despite the often large national differences with regard to rules and regulations, we saw that ethical arguments were predominantly framed in 3 ways. In the first frame, the ethics of big data is mainly presented as a balancing act. Persons using this frame compare different ethical values or principles with each other. As different ethical values become outlined in relation to each other, the ethical thing to do becomes envisaged as an attempt to find the right balance. For example, many policymakers argued that a balance needs to be found between economic values, such as innovation capacity, and public values, such as privacy and preventing data breaches. Doctors often discussed the need to balance professional values and scientific values with legal values. Think, for instance, of delivering good care, knowledge development, and data integrity. By framing the role of ethics as a balancing act, values are perceived as comparable. This way of framing thus assumes that values can be weighed against each other, almost in a cost-benefit type of way. This is, however, not always the case. For example, it is hard to see how the value of privacy of patient data now can be measured against the chance that sharing patient data might contribute to improved treatments in the future. Because there are different values and different chances at play, we cannot simply calculate the optimal balance. The second frame is of the technical fix. Ethical problems with big data technologies are seen as temporary problems that ultimately will be solved through technical solutions. I will give 2 examples to show this. First, data scientists and technology developers recognize the ethical risks of re-identification and lack of informed consent, but argue that with the right instrumental and technical solutions, these risks can be contained and dealt with. Second example. Many policymakers argued that we need better procedures, such as using broad consent for research, as a solution for the ethical problem of repeatedly asking for consent every time you want to study different things or include additional data. The implications of this frame are on the short term the normalization of ethical dilemmas. We call this ticking the box ethics. When ticking the right box, ethical issues seem to be solved. With this approach, we risk reducing ethical discussions to things that are relatively easily solvable, and we overlook their complexity. For instance, how do we deal with the trade-off between performance and transparency? Do we mind that uncertainty increases about how we obtain the diagnosis if machine learning algorithms outperform clinicians? The third frame is that of ethics as a collective process. People recognize that ethics is an ongoing process of joint deliberation. Ethicists and legal experts recognized that big data technologies are fundamentally uncertain and unpredictable. They therefore require continued attention and revision. In this frame, ethics is viewed as an open-ended process in need of continued reflection. This reflection should not only be done by experts, but also by citizens, because the societal legitimacy of big data technologies is viewed as important for their success. A good example is provided by the French Data Protection Agency. This agency organized a series of public debates on the ethics of algorithms and artificial intelligence across France and used this input to formulate advice. This type of ethics requests for the democratization of ethics. The aim is to open up the realm of ethics to different views, including laypersons affected by new technological developments. Underlying this request is the idea that new technologies will affect many citizens, and that this entitles them to become involved in ethical deliberations. These three frames show that there are very different ways of thinking about the ethical dimensions of big data technologies. We therefore argue that ethical discussions about big data can be enriched by better taking into account how various stakeholders construct ethical arguments. We think that more awareness of these frames and their consequences is going to lead to a better and more nuanced debate. Paying attention to argumentations and ways of reasoning can therefore enrich the ethical discussions about big data technologies. In the BigMedilytics project, each group constructed ethical arguments through which they seek to legitimize or problematize a particular use of big data. We learned in BigMedilytics that it is important to make these ethical arguments transparent, and that the whole group reflect jointly on their arguments and daily practices. Health professionals, policymakers, data scientists, technology developers, and legislators may have different ideas about what they see as the most relevant ethical challenges, who the primary responsibility has, and which directions to pursue. We think that the plea for more focus on ethical frames does not mean that rules and ethical guidelines do not matter anymore. Of course, obvious cases of unethical use of data or ethically problematic actions should be subjected to clear standards and penalties. At the same time, it would be wise to recognize that there is a large gray area when it comes to ethical use of big data. Abstract ethical principles need to be translated into daily work and actions, in which often many different norms, values, and ideas about good care prevail at the same time. A focus on how ethical arguments are developed by different actors in big data experiments offers valuable insights about how ethical questions are navigated in real medical practice, how considerations are made and justified on the ground, and how norms and values are negotiated in real life. In this video, I explained why we need to pay attention to ethical arguments of various actors working with big data technologies in practice. Ethical deliberations in healthcare big data teams can help to navigate the ethical dimensions, to make explicit underlying assumptions and patterns of reasoning, and thus jointly develop responsible forms of data usage. In this way, the promises of data-driven healthcare can become reality.